So I'm pleased to be here, and it's so nice to see so many people here on a Saturday morning wanting to learn more about macular degeneration. And you heard a nice summary of dry and wet macular degeneration from Dr. Shu and Dr. McGuire. Now, a common question we'll get is, if I have dry macular degeneration, am I at risk for developing the wet form of the disease? And the answer to that is yes. And then the next question we'll get is, well, what's the chances of that happening? So the studies have shown that if you have dry macular degeneration in both eyes, then on average, every year, 2% of those people will develop the wet form of the disease. And if you have the wet form of the disease in one eye, you have a chance of developing the wet form of the disease in the other eye on the order of 10 to 50%. Our goal is to detect and treat wet macular degeneration as early as possible, because the earlier we get to it and treat it, the better the result for vision we can give you. So here's the example of that. So the earlier we get to wet macular degeneration, the studies have shown the smaller the lesion, the better the vision, the better the result for vision. And here on the left, and I know the lighting can't really see the photos, but you make out some details here. These are pictures of the back of the eye. And over here, we have a patient with early wet macular degeneration. So when we were talking about the camera, this is a picture of the film in the back of the eye, the retina. And this yellow over here is the nerve. That's the cable that connects the camera to the brain. And this red over here are the normal blood vessels in the back of the eye. In the center part of the retina, this patient has swelling, and this red here is a blood spot in the back of the eye from wet macular degeneration. So this is a patient with early wet macular degeneration. This is where we want to catch it and treat it and give a good result for vision. On the right, you have a patient who has end-stage wet macular degeneration with scar tissue. And again, this is the nerve, and these are the blood vessels. And all this yellow over here is scar tissue from the wet macular degeneration. At this point in time, intervening is not going to help much with the vision. So our goal is to get to patients when they're here. So how do we do that? Well, we can't examine the eye every day. So once you have a diagnosis of dry macular degeneration or wet macular degeneration in your eye, then we have tools for you to use at home to check your vision every day and let us know if something's changing. And one of those tools is called the Amsler grid. So the way this works is it's a chart of straight lines, horizontal and vertical lines, and this is what a normal Amsler grid looks like on the left. And what you do is you put it on your fridge or somewhere that you can look at it every day. You cover one eye, you look through the reading part of your glasses at that center dot, and all those lines should appear straight, horizontally and vertically. Whatever you notice on it, that would be your baseline, and then you check it every day. And if you notice that some of the lines start appearing wavy to you or are missing, and that's new for you, then something's changing with the back of the eye. You should call your eye doctor, let them know so you can get in for an eye exam as soon as possible, and they can see if something's changing to wet macular degeneration, so we can catch it and treat it early. Now, recently we've developed even better ways of monitoring your vision at home, and that's with this 4C Home AMD monitoring device. This is another device that can be used at home. And basically, you look through this machine, and it flashes targets, and these targets look like dotted lines. And on that target will be a bump. And what you have to do is point at the part with the bump in it. And this information then gets transmitted to a monitoring center. And when something changes in the back of your eye, the monitoring center alerts your eye doctor so that you can set up an eye exam as soon as possible. And what the studies have shown is that 94% of patients who have this device use it regularly and develop the wet form of the disease are able to regain functional vision in their eye versus people who use the conventional methods of monitoring their vision at home, which is 62% of those patients. So this is an effective way of monitoring your vision at home. So now with wet macular degeneration, just going back to this slide here, think of it like abnormal blood vessels. Basically, in the dry form of the disease, you get the age deposits, and that weakens the outer wall of your retina. And then abnormal blood vessels can grow through like weeds underneath the retina, and that can cause leakage. And we have effective treatment for that. And you can think of them like weed killers, medication that we can give you to make those abnormal blood vessels go away and help stop the source of bleeding and fluid inside your eye. And Dr. Kaiser is going to talk to you about what those treatment options are.